My name is Grace Kistner, and my representative is Mary Miller. I'm a nurse, and my experience in healthcare and promotion stems back to 2007. I'm here today because I've seen firsthand what happens when families lose access to healthcare, and I know the devastating impact Medicaid cuts will have on families like mine. I grew up in a rural part of Illinois where access to healthcare has always been challenging. As an ICU nurse, I've cared for some of the sickest patients in our healthcare system. Many of the people I see are critically ill, and sometimes, especially for those with low resources, because they couldn't get the preventative care that they needed. Exactly what happened to my brother. He was overloaded with college debt, didn't have income or a car, and didn't want to bother anyone getting help with getting access to care. He looked up his symptoms and tried his best with self care at home, but he got sicker. Eventually, he had to go to the ER, and instead of worrying about getting better, he was worried about how much it would cost. After going through a lot of tests, the doctors still didn't have a diagnosis and sent him to a specialist at a hospital hours away. He spent over a week in an isolated room, and the cause was still elusive. Once he was released, he had a slew of new prescriptions, more visits, and specialty diagnostic tests. Only after all the bills started mounting did the staff tell him about Illinois' expanded Medicaid and ability to cover what he'd already gone through, plus prescriptions and transportation for essential visits for years to come. He also has a mental health diagnosis that Medicaid helps to cover, along with routine care and preventative services. After watching my brother struggle for so long, for the first time in his life, he's healthy, lives on his own, and works to support himself. Medicaid is a lifeline for him that keeps preventable situations from happening. Without it, more people will delay care, more conditions will go untreated, and more families will face devastating outcomes. These proposed Medicaid cuts aren't just budget numbers, they're a direct threat to the health and safety of people in our communities. Preventable conditions cost our healthcare system billions of dollars each year that affect everyone, and Medicaid cuts will only make that worse. It can make private insurance costs increase and health facilities to close, often where access to care is already limited. And that's why I'm here today, because Congress recently passed a budget that guts Medicaid funding, and Illinois Representatives LaHood, Miller, and Bose voted for it. Mary Miller must hear the people who elected her and put them first. We need leaders who will stand up for working families, children, seniors, and people with disabilities, because some cuts don't heal. Illinois families deserve better. I'm calling on all elected officials to vote no on any cuts to Medicaid, to protect it and ensure it is a thriving program for current and future generations.